Good afternoon, and welcome to the Mental Health in Schools concurrent session of the School Violence Prevention Summit. I am Dr. Rebecca Sokol, and I will be moderating this session. Thank you for joining us. We are so glad you're here. As a reminder, this session is being recorded. Only the presenters and moderator are visible and are allowed to turn on their audio and video. You will notice on the right-hand side of the screen, you can toggle between the questions and answers for the event and the session noted by stage. And the stage questions are indicated by the session feature on the right-hand side. Be sure to, so you'll notice that the session toggle has all of the questions for this concurrent session. And so if you have a question for our presenters, please type that in the question and answer for the stage noted by the session. Be sure to indicate who your question is for by indicating the presenter's name at the beginning of your question. Question and answer will take place after all the presentations, but we encourage you to send in questions throughout the session so we can have a chance to review them. We will answer as many as time allows. Our presenters will have 10 minutes to present, and there is one other concurrent session occurring at the same time. And as much as we want you to stay in the session and listen to all the great presentations we have lined up, feel free to jump in between sessions as you wish. Now, presenters, I invite you to share your video. And please join me in welcoming our session presenters. These include Dr. Terry Sullivan, who is a professor of psychology at Virginia Commonwealth University, Dr. Rand Astor, who holds a Marjorie Crump Chair Professorship in Social Welfare at the UCLA Luskin School of Public Affairs, with a joint appointment in the UCLA School of Education and Information Studies. And finally, Dr. Sarah Lipson, who is an assistant professor at Boston University School of Public Health. Presenters, when it's your turn to present, please turn on your audio and video and then turn them off after you're done. Okay, so let's begin with Dr. Terry Sullivan.
Thank you very much. I'm really excited to be here today and to present on bullying prevention initiatives in middle school. I did want to take a moment to acknowledge my collaborator on this presentation, Dr. Melissa Washington Norte. Next slide. Also wanted to acknowledge the research team who worked so hard on this project. I especially wanted to acknowledge the students, staff, and faculty at the 3 middle schools who are at the heart of this project. Next slide. My presentation today centers on the evaluation and impact of the Ulvaeus Bullying Prevention Program. First, I wanted to talk briefly about a long-term evaluation of the program that we did spanning the years 2010 to 2018. Then I'll turn to a qualitative effort that explored how the Ulvaeus program enhanced positive relations among students and with their teachers. Next slide. In deciding on the Ulvaeus Bullying Prevention Program, we followed the school district's lead as they selected this as their middle school bullying prevention initiative. Resources that we brought from the project included a full-time youth development specialist and a certified Ulvaeus trainer consultant. We wanted to do a long-term evaluation because we wanted to help in the understanding of why widely implemented programs like Ulvaeus could help administrators and school staff identify programs, especially programs that could be tailored within an overall framework to meet individual school needs over time. Ulvaeus is a whole school program intervention. It has components at the individual, classroom, school, and community levels. Examples include individual level components, school staff being aware of students' activities, stepping in on the spot to address a concerning situation, classroom level activities, regular classroom meetings. Examples are looking at anti-bullying rules, looking at respecting oneself and others, social problem solving, goal setting, coping with stress. School level components at the heart of this is a coordinating committee that focuses on providing trainings and refresher trainings for all staff, supporting school supervision plans, coordinating school level activities. Next slide. This slide shows a little bit about our research design and how the Olveus program was implemented in each community, the schools within the community. And so the start time of the program and the order was randomly assigned. And this helped us in understanding if decreases that we saw were kind of happening concurrent with the implementation of each program in each school. Next slide. This slide summarizes the intervention impact on victimization, and we had teacher and student report. And as you can see, when we looked across the years, we saw physical victimization and verbal and relational victimization decrease based on teacher report. We did have some differences based on sex and grade. We found more consistent effects for relational victimization for girls than boys, and we found stronger effects for 7th and 8th graders versus our 6th graders. For our student report, we saw intervention effects on in-person victimization. This is a combined measure that looked at relational, physical, and verbal victimization over the course of the intervention. And we did see decreases in cyber victimization, but they took a little bit longer to kick in. They started in the second and third and subsequent years of intervention. Next slide. If we look at the impact on aggression, school safety, and school climate, we did see decreases in teacher report across the board, across our intervention years. For students, we didn't see changes in physical aggression based on their report. We did see changes in decreases in relational and cyber aggression, but they didn't kick in until about the third year of implementation. For school safety, we saw a significant decrease in the first year, but not subsequent years. And for school climate, we didn't find any significant findings. We did see a decrease for boys in the third and subsequent year on reports of positive peer interactions. Next slide. So I think overall, if we look at kind of reflecting on the findings before I turn to the qualitative study, we did have some differences in the timing of effects. We found that if you look at subtypes of victimization and aggression in terms of physical, relational, and verbal, we saw some, for the teacher report, we saw some decreases in physical aggression and victimization before we started seeing verbal and relational. And just more overt acts may be, more consistently recognized, observed, and reported by students to the teachers. We also saw differences based on sex. We saw relational aggression and victimization and verbal aggression decrease for girls across all the intervention years, but for boys, we found this in the third and subsequent year. And there's some evidence that girls perceive relational aggression as more hurtful and harmful than physical aggression, and so they may have been more likely to report this to their teachers. The differences we saw in terms of grade level, I think, fit really well into the idea that as the intervention continued over multiple years, our 7th and 8th graders were showing, more stronger effects. They'd receive the intervention for a longer period of time. Next slide. One thing that we noticed when we looked at school climate, we were really curious about why school climate, didn't decrease. And the measure of school climate was pretty broad. Some examples of the items are students at the school are interacting or getting to know other students. Students at the school get to know other students well. They get to know each other well in classes. So we wanted to delve into this a little further with qualitative data to really understand a little bit better about how the Olveus program may foster positive student-student and student-teacher relationships. Next slide. To do this, we interviewed 8 administrators and 8 individuals on the coordinating committee, and we conducted focus groups with 26 teachers from the 3 participating schools. Average age for group members was 45 to 52. 79% of participants were African American, 19% white, and 2% Latina. Our coding team was diverse in terms of race, ethnicity, sex, and experience with the intervention. We had training in qualitative methods, practicing coding and instruction. And our coding process, we went from open coding to axial coding, and then we did some selective coding as well. Next slide. And I wanted to share some of the themes that came up as we coded the data. Teachers, administrators, and coordinating committee members talked about how class meetings and the events held by the coordinating committee created consistent opportunities for engagement and discussion. The class readings, that setting where they're talking about different things, practicing expressing their feelings about not so great incidents, I think that fostered more interactions with the teacher. Next slide. School staff discussed how the Alveus program facilitated teamwork and collaboration. One example was more enthusiasm about teamwork and collaboration skills. This year, students, they were more inclined to do more activities that were group related or pair related, as opposed to those that just involved self. And one participant described how working with students on the kickoff helped to develop relationships. Next slide. Another theme discussed was increases in student-teacher rapport, relating to each other, and connection. In referring to the class meetings, one teacher said, I think one of the things it allowed us to do was share just who we are as a person, that what we've grown up with, to get them to understand that they're not going through the same stuff alone. And just being able to have an open dialogue with kids, not always in the teacher role, kind of being able to step out of that role to build and create a rapport between teachers and students. Next slide. Another theme that emerged was that the meeting with students fostered student-teacher trust. One example of a quote was, I think teachers opened up as professionally as they could, allowed students to feel like they could open up and talk about their concerns or go to a teacher. Next slide. Lastly, staff described how the Alveus program expanded and strengthened friendships, improved student and student teacher interactions, how it gave them a platform to listen. Even if they didn't totally agree, they could express their ideas. And one teacher explained how students would bring others. One student brought a friend and said, this is what's going on, this is what's happening with her. Next slide. So in wrapping it up and thinking about reflecting on this, teachers reflected on the ability to get to know students more personally, which facilitated their own relationships with students. The class discussions may facilitate critical thinking, self-reflection, and appraisal of challenging situations. Teachers talked about being able to tailor discussions in the way they felt was most relevant and meaningful for students, and having consistent meetings with the same group of students. There weren't assumptions about rules. There was a lot of collaboration in a collaborative process. And, I think wishing and thinking for the future, I think one thing I wish is we had collected this data over the entire intervention. We collected at the end. I think we learned a lot about how the intervention was working in the smaller settings of the classroom, and how teachers and school staff were getting to know their students and kind of working with them on the goals of the Alveus program. Thank you very much.
Hello, my name is Ron Aviaster. I'm at the University of California, Los Angeles. When I did this work, I was at the University of Southern California. And I'm going to be talking to you about a welcoming empowerment monitoring approach, WEMA. This is an 8-year follow-up study of 145 military-connected public schools in California. And we have evidence here of very large reductions in prevention of the bullying, victimization, and substance use. I'm going to just use this instead of say next slide, so I'll just have that go across. Again, that's me. Next slide. Uh, if you're interested in getting into the details of the findings of our work, it's in this particular article. We can make it available in Research on Social Work Practice. I am in social work and education in addition to being a psychologist, and you'll see that in my background in the way I go about doing things. So I am presenting right now on California data, but just so you'll know, for the last 20 years, Israel has been using this approach in all of its 5,000 schools, Chile in about 75% of its schools, parts of Quebec have been using it as well, many other countries. I usually don't start a lecture by showing data, but I'm going to show you the end of the story first so you can see, because some of the things I'm going to talk about are super simple. So what I want you to be aware is that even with issues such as weapon use, gun carrying, seeing a weapon at school, we had massive reductions by using this empowerment approach at scale. It's every school separate, every school gets what it's need. District levels are then built around those kinds of needs for that particular period of time. Regional connections are then formed. I'll be talking about that. But what's really important is that even on something with weapon use, you can see by focusing on issues of the individual school, not the individual child itself, we see big reductions. Next slide. Just to show you again, some of these are over 50% reductions, 35, 45% reductions, and this is for lifetime substance use. So that means that kids who then attended these schools who may have had risk factors actually never became substance use users. So it's almost like a primary prevention or like a vaccine. Next slide. And the same goes for victimization and for bullying over a period of time. You can see between 2009 and 2017, really massive reductions in specific behaviors, not just a general category of bullying. And again, just in case people were wondering, even in the here and now, we saw big reductions as time went on. You don't see it at each individual level as it goes on, but you could see over time those trends going down. And some of those, starting from the beginning to the end, again, are very large. You wouldn't think, from what I'm going to show you, that gang affiliation might be reduced. But again, it worked almost like a vaccine. If you had those risk factors and you attended those schools, if the school actually did the WEMA process, they actually never became gang members. And you can see here, there's about close to half, a 50% reduction in gang affiliation over this period of time. So now we're going to get to the issue of school climate, which many researchers are having a hard time showing any kind of changes. But our major focus at the school level, at the district level, and at the regional level is to actually change these relationships within the school, the academic press and environment, which is sometimes not talked about, school safety, and usually we're talking about more positive kinds of approaches and not law enforcement. We'll talk about that in a second. The physical environment, students, teachers, and parents belonging, not just students, and the classroom context itself, whether it's fair, caring, and supportive. More detail in our books. And I would be remiss if I didn't bring up the issue of context. Because when we talk about context, we often talk about the physical neighborhood and community, but the context of the world and what we go through matters as well. And I don't need to even mention, the COVID-19 crisis, because that makes us super aware. Black Lives Matter, what we do now versus what we did 10 years ago, this has to be incorporated because it's affecting every child, every teacher in our communities. And again, some of the things that we talk about are happening worldwide. The political shifts, the views towards the vulnerable groups that we're talking about. And I think if our programs are not evolving, if our thinking is not incorporating the here and now, we're really implementing things from 10 years ago. There's a whole genre of approaches I'm going to talk about that actually make the school more loving, more caring, more supportive. And I think that's where most academicians are coming from. And there's a tension right now between that and some of the law enforcement approaches. And I don't need to say the mental health issues post-COVID and all these other issues I talk about, that we really have a worldwide crisis on this issue. Do I need to say more about the political splits that we see in our country, regionally, city by city? Our research and our interventions need to start including that, because school boards are the ones that fund it. Communities are really different, and we have to start incorporating all those issues together into one. We were hoping with this grant that we would have a lot of money for mental health funding, but we also have a lot of money that's being used for law enforcement. Some of it is positive, some of it is not so positive. There's just a list of some of the things that we know we have data that actually is harmful for students long term. It is counterindicated with some of the programs that we have. So what I'm going to talk about is really more this more caring approach and how we can move this caring approach more into our way of thinking. Sometimes in the way we go through these presentations is what I call window air conditioning. You have a program. If the school really wants to do everything, they may need to do 12, 13, 14 different programs to get the whole picture done. And that's in fact what we're seeing across schools around the country, which is making me a little bit concerned. I'm pushing more for central air, integrated system where everything flows and makes sense. So, if we go by Dewey's quote, education is not preparation for, life. Education is life itself. This is kind of encapsulates most of the WEMA approach. So our thinking was going way back when we saw programs after they got evidence-based kind of stamp of approval, they weren't working at scale. They don't work over time without the funding of the grant. So we started thinking in Israel and here in the United States more of how do we take the voices of the students, the teachers, the parents, the community, and including the school district and the school board members, and bring that into the context so you could have a living, ongoing kind of evidence-based program, decisions, policy making that's alive and well. And so you could see the bottom approach is an integrated approach at the district level, but even at the state level or the country level. And we want to take mental health resources, social emotional learning, all these other smaller programs that you sometimes see and learn about, and bring it into an ongoing, long-term, sustainable approach. And we don't think that's just implementation and practice. We think that has to be part of the theory. So what is it in a nutshell? What we've done in every school, for example, in Israel or in this particular district in California, is we took all the voices of the students using a survey, but also qualitative and mapping information. And that's each school separately because they're really, really different. We then process those voices. We bring them back to the students themselves, back to the teachers, back to the parents, back to the school district. You share those information with all these. This is the first step. And then you start a collaborating process, very social working in a lot of ways, so that the goal is to change policy and practice, and then only programs are integrated into those kinds of things. And you might have 100 different schools in a district and 50 different ways of going about a specific problem that are specifically for those communities. So the outline that we are going to, that we generally use in this is we figure out, like I said, who to monitor, what to monitor, and then we present back the information, and then we go through another round of planning. And you'll have this for later. I just got a message that I have 1 minute. It's going to be a little bit longer. And I'm going to cut through that one as well, too. I think what we have found in research around the world that schools vary so much, even in the same communities, that you really have to pick out what they want to work on, what their mission and goals are for that period of time. Otherwise, the program is not sustained very well. Again, we've used not just surveys, we've used focus groups, observational, data mining from the district, qualitative interviews, videos, photos as data and voice for those different groups to make those decisions about their particular school. And again, it's not just a beginning at the end, it's an ongoing yearly process. Within the year, there's 3 or 4 times all those groups get together, the voices of the students, staff, teachers, parents, and community, and they make decisions around implementation, awareness, mobilization on the particular kind of mental health or bullying or substance use that they want to work on. We've used mapping methods here. Here's an example of where people like to hang out, it's fun, but where they've also seen victimization, how the school's response has been to that. And we've done that again with community. And here you could see kids are telling the administrators there's no place to get into the school. So I'm going to switch because I'm almost running out of time. When you get that kind of information, again, it's very important that it's fed back to the subgroups, by gender, by grade level, by vulnerable groups, but also at the district and at the community level, because that's where all the change takes place, and that's how it keeps on going. I have 100 examples in the question and answer period of how we took each of those pieces of information and put it at the various different socio-ecological levels. It's been working for more than 20 years in Israel, for more than 10 years in Chile, and we see these same massive reductions. In the data that I presented you, we went in 4 years after we finished the intervention, and it's actually getting stronger because we think infrastructure has been built around it. And that's it for now. Thank you very much, and I look forward to questions and answers.
Hi, everyone. It's great to be here today and to have a chance to add to this great panel of presentations. I'm going to shift our gears just a little bit because the research that I do is focused on college settings. And so I'm going to kind of lay the stage in terms of what we know about mental health in college student populations and how sense of belonging is one of the most important protective factors for student mental health, and thinking about some of the ways that we can be promoting sense of belonging, particularly in higher education settings. Next slide, please. So just a little bit of background of like, why should we care about mental health in college student population? So one reason relates to the age of onset. So about 75% of lifetime mental health problems will onset by about age 24. And so, of course, there are, many adolescents and young adults who are experiencing mental health problems before they matriculate to college, but about half of all adolescents and young adults are enrolling in U.S. post-secondary education. It's a really, key time from a developmental perspective that often coincides with either the onset or intensification of mental health problems. The second reason relates to the treatment delay. So for mental health problems, the delay from when someone first experiences symptoms to the time when they access mental health services, on average, that delay in this country is about a decade. And given the age of onset, we know that school settings, both high school settings as well as higher education settings, are a really important time to be able to identify people at risk and try to connect them to resources to reduce that really significant treatment delay. And we also know, of course, that many folks never access mental health services when they're struggling, and there's a lot of negative consequences related to that. And there's just so many kind of unique opportunities that exist in school settings, including in higher education. So as I said, it's a really significant time from a developmental perspective, newfound autonomy that students are experiencing. Then there are just so many human resources that exist on college and university campuses. So from peers, that's probably the most important human resource and the largest group on campus, and kind of what students think about when they think about the people that are around them. Peers are some of the most important. So human resources of peers, also of staff. We can think of athletic coaches, advisors, career services. These are all employees on campus who have the potential to identify students at risk, and also have the potential to shape a myriad of outcomes for students. And then, of course, faculty. College is one of the only times, particularly if we think about a residential college or university where students are living, and we think about undergraduates living in residence halls, it's one of the only times in most people's lives when pretty much every aspect of their daily life is encompassed within a single institution. So it's where they live as students, it's where they work, their job as learners, but also potentially their jobs, work-study jobs or other student jobs on campus. It's oftentimes the college or universities, oftentimes how folks are accessing health services. It's also where their peer networks are. So all of those have the potential, all of those avenues really have the potential to shape mental health. We can think about structural interventions to try to promote positive mental health and well-being. And then lastly, mental health during college is predictive of pretty much every long-term outcome that we care about, from future physical health, economic productivity, social outcomes. It's also predictive, of course, of whether students persist in higher education, as well as their performance, their GPA. Next slide, please. So my colleagues and I, including I was at University of Michigan for many years. I did my PhD there with Daniel Eisenberg, and started collaborating with Justin Heinze, who is now a co-PI of the Healthy Mind study. So we have still a really strong connection with the Michigan roots, though I am now at BU. And so we have been conducting this annual survey study, the Healthy Mind study, collecting data from students across the country. We've done it. We'll be getting close to that million student mark either this semester or next academic year. So it's a really large scale survey conducted online. And this is just a map of the campuses. Next slide. So I'm going to share, I think, 3 slides in a row, maybe 4 slides in a row, that are all oriented the same way. And it's every bar is a year of data from the Healthy Mind Study survey data. And this is our measure of flourishing or positive mental health. It's an 8-item scale. And you can see from 2012 to 2022, there's been declining levels of flourishing from about 57% in 2012 when we added the measure to about 29%. So a significant decrease in flourishing over time. And you'll see in several of these charts that it's really right around 2016, 2017 that we start to see the sharpest decreases. Next slide. So oriented the same way, this is our 9-item measure of depression, the Patient Health Questionnaire 9, and this is the proportion of students who are screening positive for symptoms of major depression. You can see in 2013, about 1 in 5 students, 22%, were screening positive for symptoms of major depression. In 2021-2022 academic year, 39%, so significant increase. And again, it's right around 2016 that we start to see the sharpest increases. Next slide. And so another oriented by year, and you can see anxiety. This is our 7-item measure of the Generalized Anxiety Disorder 7 scale. In 2013, 17% of students were meeting the cutoff for anxiety, and in 2022, 33%. So nearly a doubling in symptoms of anxiety. And again, the trends seem to be most pronounced starting around 2016. Next slide. So this is our indication of suicidal ideation, where students agree yes or no to the question, have you seriously considered attempting suicide in the past year? We've had this item in the survey since the very beginning. You can see in 2007, about 6% of students, so well under 1 in 10, still concerning, but 6% were reporting that in 2007. In 2022, about 14% of students, so more than a doubling in the proportion of students reporting suicidal ideation. Again, right around 2016, 2017, that we start to see the sharpest increases. And I'll also note that in each of these charts, you wouldn't look at the years, 2020 and 2021 and say, oh my gosh, what happened? The levels were so low and then all of a sudden they jumped up. That's really not the case. The prevalence levels were high even before the pandemic, but they've continued to rise. So we kind of think of it as a continuation of a troubling trend as opposed to a unique spike in prevalence. Very importantly, we have seen widening of inequalities in some of our other measures. And one of the things that I really want to turn to now, of course, is looking at sense of belonging, because that is an outcome that is shifted quite a bit during the pandemic. So if we could go to the next slide. So this is our measure of loneliness. It's the 3-item UCLA loneliness scale. You can see about 2/3 of students report feeling like they lack companionship, feeling left out, or feeling isolated from others. So it's really this paradoxical situation where the majority of people feel like they are alone. And so I think this is one finding, just given the ubiquity of loneliness in adolescents and young adults. I think this is an important finding for teachers and faculty to kind of grab onto. We are not trained mental health professionals. Sometimes you feel like it's perhaps not the right thing to say that faculty are, going to be helping with, severe symptoms. That's really not our role. That's not what we're trained to do. But we have a lot that we could do to try to address loneliness, even in classroom settings. So trying to really promote belonging, have students get to know one another in class, have time when they're able to, really be part of a community together. Next slide. So sense of belonging, of course, and I know I only have 1 minute. I'll similarly take the plea that I maybe have 2 more minutes left. But sense of belonging, of course, the fundamental human need that can powerfully influence behavior. There's a lot of variation in terms of how belonging has been operationalized in research, but studies have consistently found that a weak sense of belonging is associated with poor mental and physical health and even suicide. Whereas strong sense of belonging has been shown to be a predictor of flourishing or positive mental health. And importantly, evidence from longitudinal studies suggests that sense of belonging shapes emotional and behavioral adjustment rather than the reverse. So that's some context for us. Next slide, please. So you can see here in our data, this is an item where students agree or disagree with the statement. I see myself as a part of the campus community. So that is a measure here of belonging. And you can see that in 2020, 2021, if we take ourselves back to that year, a time that there's a lot of remote learning, masking, of course, physical distancing, you can see that sense of belonging dropped down a little bit during that year. Next slide, please. We see significant variations in sense of belonging across student identities. Here, I just want to highlight the disparities that exist for LGBTQ students, particularly trans and non-binary students. About half of trans and non-binary students say they don't see themselves as a part of the community. About 40% say that they feel isolated from campus life. Next slide, please. And this is, I believe, my last slide, but in the Healthy Mind study, we asked students that item of, I feel I'm a part of the campus community. And among those with the lowest levels of belonging, about half screened positive for one or more mental health problems, relative to about a quarter of those with higher sense of belonging. So this is really one of the strongest correlations that we see in our cross-sectional Healthy Minds data. Next slide, please. Great. Thank you very much. I'm looking forward to the discussion.
Thank you, all presenters, for this super informative session. We have time for, I think, probably just one or so questions. So if you could all please turn your cameras back on for the question and answer session. And I'd like to start with Dr. Sullivan. Could you give some insight into what you think are some unique considerations for bullying prevention programs for middle school versus elementary school students?
Sure. I think that when you look at the middle school setting, it's a real difference from the elementary school setting in terms of it's typically larger. Students may have had 2 or 3 teachers, practice rotating some in elementary school, but now they could have 6 to 8 teachers. I think the expectations go up in terms of academics, in terms of organization. And so I think in thinking about this, one of the things that the Olveus program did is it created a space for students it was one class with one teacher, but all the teachers and all the students in the school where they could have conversation apart from academics, where they could talk about how they were doing, how they were feeling, and talk about, different aspects in terms of coping with stress or some of the topics. So I think it was a way to kind of create a point of connection that I think was very relevant when we think about the middle school setting as compared to elementary school.
Great, thank you so much. And I did just see a question come up in the session questions. The question is, how have we seen trauma-informed care training affect these statistics and experiences? And I think that question can go to any of you 3 presenters.
I don't know, Sarah, did you want to take that or?
So, I think there's an enormous priority around advocating for trauma-informed care and thinking about the different forms of trauma. I think if we're centering equity in mental health, if we're saying, we really care about the mental health of students of color, of students from low-income backgrounds, of LGBTQ students, many of those communities have disproportionately experienced trauma, particularly in recent years. So I think a trauma-informed approach is, and a culturally relevant, tailored approach is of course, excuse me, the goal. But I don't know of any evidence around the effectiveness of trauma-informed care on population-level outcomes.
Right.
Yeah,
Our data is a little bit concerning on that in particular because we've actually asked people, is your school a trauma-informed school in it too? But so first we see really large variation in California, even on the measures that, you know, Sarah talked about. You have schools with 3% suicidal ideation and depression, schools all the way up to 70% in the same community, same risk factors. And so when you do trauma-informed care, it has to be around what the needs are in that particular school or class or community at that period of time. We don't see that happening. The other thing that we're concerned about is that with the huge amount of funding, the trauma-informed schools that we're seeing nationally that people are calling trauma-informed also have a lot of contraindicated programs, law enforcement, zero tolerance, suspension and expulsion, spanking, a lot of other kinds of things, you know, corporal punishment. So, you know, the idea that it's a philosophical approach that you could care, but at the same time spank kids, or that you could expel them, or that you could have dogs sniffing, is problematic. And I think researchers have stayed away from that. They've been very close in their lanes looking at the particular issue. So looking at the school-wide approach, I think it requires a stronger philosophical point of view of what's allowed and what's not allowed. We've only talking about what's allowed, but not what we shouldn't have. And I think that's kind of where we're at politically.
Yeah, well, thank you all so much. I really appreciate this discussion. And we do have to wrap up this session now. And I just want to extend my thanks to everybody for attending and joining the session. You'll be receiving an evaluation survey within the next few days. And so we encourage you to fill it out to help us continue to grow and improve. Please also fill out the evaluation survey to request continuing education credits. And if you're not already a member of the Injury Prevention Center, please go to our website, which is posted here, and you can gain access to our monthly newsletter. And as a reminder, all sessions were recorded today and will be available on our website in the coming weeks. And so next we have a short 10-minute break, a little less than 10 minutes, and our next concurrent session will start at 2:25 p.m. So again, thank you again for attending, and thank you to all of our presenters for their important work in school violence prevention. We all truly appreciate it, and I hope you all have a great rest of your day.